do you think there's a possibility that particularly the older generation won't seek help because it's an aspect of their body which they're not comfortable talking about?
Yes, totally.
Which leads me on to another question, which is, you are a specialist in obs and gynae issues, so people like this lady you've been talking about has come to you specifically with this problem because she quite coincidentally found out that you dealt with it. But have you come across patients, are we likely to see patients who will come in with a different musculoskeletal issue, but we might by some method discover that they have a pelvic floor problem, have vaginismus?
Yes. So I think it's difficult if you are male sometimes to ask these questions, whereas as a female, it's not. So one of the things that I've educated my male members of my team here is just be delicate about it. So I have a climber coming to see me. She was seeing my colleague downstairs for a hip issue. And when he said to her, okay, you can go back to climbing, and she said to him, actually, I'm not sure I can climb anymore. And he said to her, is it because of your hip, or is there something else that you worried about? And she said to him, lady issues. And
Right.
and I think that was a really nice way of just going. So of course now she's been referred to me. She had no idea I existed, even though I'm in the same practice. And it was just very much, I fixed your hip, you should be able to rock climb. So why aren't you rock climbing?
Yeah.
And it's just is there anything else we want to talk about? Now, for me, I will always go, well, I'm the women's health specialist here. Is there anything else I can help you with? Are you not running? Is there any other reason why you wouldn't be running? Especially if they kind of mention it. And sometimes women will say things like, well, after 2 babies. And then you're like, no, I don't know after 2 babies. What does that mean? And then we open this conversation of like, you shouldn't just accept after 2 babies, you're going to leak when you run. And a lot of the time it's that sort of semi-casual but not really casual conversation that people will find out where you are. The other thing that I always do is in a social situation now, I always tell people I'm a women's health physio. I very seldom say that I started off, well, I mean, obviously I am a normal one as well and do normal MSK, but I feel like it opens a conversation, especially for men, where they'll go, oh, I don't know what that is, and you tell them. And the amount of times at a social function, a man has surreptitiously come to me and gone, could I have your card? I think my wife needs you. And
Yeah.
it's about opening the discussion.